I have a meniscal tear and I'm thinking about undergoing stem cell injection. Should I go ahead or not go ahead? To really answer the question and to give you my opinion, I gotta really kind of talk to you about two aspects of the background. The first is, well, you say stem cell injection, what do you mean by that? Or stem cell therapy? And then the second thing is looking at the context. Stem cell therapies are experimental, they're alternative, they're not covered by insurance, so they're expensive. So we don't want to rush into them until we've really exhausted traditional treatments which have been proven to work and we know exactly what's going on with them. There's two menisci in each knee. One's on the inside of the knee, the other's on the outer part of the knee. They are cartilaginous structures, they're for cushioning. There's kind of three different patterns of tears. One's called radial, and that's along the radius or the curvature of the meniscus. The second is longitudinal, and the third is axial. Those are just whether you're perpendicular or parallel to the long axis of the meniscus. The kind of tear that you have might heal by itself depending on the shape of the tear. And it's probably not surprising to you that you heal better when you're younger. So people under 40 have better healing than people over 40. If your tear is going to heal on its own, you don't need to do anything. And the only way you would really know that by looking at your MRI and looking at it with a doctor and have the doctor make an assessment. A good thing to do is to say to the doctor, what are the chances that my particular tear at my age is going to heal on its own? The second thing I wanted to talk to you about are the kind of stem cell therapies that exist or are available. There's really three kinds, and the first is injection of a growth factor. The second is cellular stem cells, true stem cells, where the cells themselves are collected. When that technique is used with human blood, just from a peripheral, that's PRP. And then the third, and frankly the coolest treatment, are tissue engineering strategies. And that's where a scaffold is made, usually in the lab, oftentimes 3D printed, and then stem cells are brought in and they grow in. Number 1 and number 2 are available today. Number 3 is experimental and is, frankly not widely available, so we'll just discount it. So should I consider having a growth factor injection or having actual stem cells injected in me? Well, there's actually pretty good evidence that mesenchymal stem cell injection can help an injured meniscus. For example, Hatsushika injected MSCs, mesenchymal stem cells, versus just hyaluronic acid, and looked at an experimental defect they made in the meniscus. These are in pigs. And what they found was with the MSCs, the defect healed in 2 weeks, and without the MSCs, it healed in 16 weeks. So that's a pretty big split, 2 weeks versus 16 weeks. As doctors, we see animal studies all the time that turn out to be not very indicative. This is an experimental model, so you got the cells right after you got the injury, and we know from prior studies that the shorter the time between the injury and the stem cell therapy, the more likely it is to be beneficial. Frankly, the more likely anything is to be beneficial. There was also a clinical study, very, very interesting. They injected, in one group, they randomized, flip a coin, you get mesenchymal stem cells, they happen to be bone marrow derived, you flip a coin, you get hyaluronic acid, and then they looked at the volume of the meniscus on MRI afterwards. And what they found was patients who got the stem cells had a 24% increase in the volume of their meniscus compared to patients who didn't get the stem cells. There's also the matter of cost. You can get a PRP injection into your knee. This is something you're going to end up paying cash for. Then PRP probably end up being around $1,000 to $2,000 depending where you get it. Then comes the growth factor injections. Those are usually $2,000 to $4,000 depending on who does it and where. And then mesenchymal stem cells themselves, where they're actually having to harvest. Most of those treatments are more like $5,000 to $10,000 depending on what's done and whether they combine it with growth factors or PRP. So pretty big tiers here, right? 1,000 to 2,000, middle 3 to 5-ish, and then higher 5 to 10. Depends on where you are and who does it, but you're talking about really significant amounts of money here, and again, all of this is out of pocket, so very expensive. Bottom line, what would I recommend? There is very strong evidence in anecdotal experience of surgeons, as well as the reports out there, that stem cell therapies can be helpful. Growth factor injection is quite encouraging. It's relatively inexpensive compared to the other option, and it's very, very, very low risk. So if you can't afford it, I would encourage you to consider going ahead with a growth factor injection. Mesenchymal stem cells, I think right now we're getting some very important information. It's very encouraging. If you came to me and said, I want this, let's do it, I would say, well, I would talk to you about the risks of infection. It may not work. But if you're willing to take that risk and you're determined to do it, I think it's a reasonable thing to do. Would I recommend it? Probably not yet. I think it's coming. Well, that's all I have for today on the subject of meniscus injuries and whether or not you should have stem cell treatment. Any questions, feel free to email or contact us here at Phoenix Spine and Joint. Thanks.